welcome to today's edition of 1 Minute Answers from 1 Minute Economics, the show in which I answer your economics related questions in a minute or so each. And before getting started with the 3 questions you have asked me about healthcare, I want to pick the topic for next week as usual, and the topic for next week is going to be war. Now, I realize that, given the delicate political climate in the world today, a lot of people have concerns about what would happen if a war would break out, what the economic costs would be, and so on. So if you have any questions at all about war, please ask me by writing a comment below, and I'm going to do my best to answer them next week. The first question for today has been asked by Suraj, who would like to know more about the single-payer healthcare system, and more specifically, if the benefits outweigh the costs for people at various income levels. And for those who don't know, single-payer healthcare system is basically a system in which healthcare is provided as a public service. So in the United States, for example, you do have some spending by the United States like Medicare and Medicaid, but mostly it's a system where services are provided by the private sector. So a single-payer system would be, simply put, a system in which healthcare services are provided as, a public service. Now, with that stated, let's get started. And I'm going to start by mentioning the pros and cons of the single-payer system. And the main pro is the fact that you have this huge entity, the state, that has an immense bargaining power due to its sheer volume. So therefore, it's in a good position to negotiate discounts on hospital beds, medication, and pretty much everything else. And 2, there's of course the social component, because the government is more likely than a private for-profit company to offer services to the poorest individuals, even if the numbers don't make all that much sense. The 2 main cons, on the other hand, are the fact that 1, in a lot of countries, the government is not very good at managing people's money for reasons which range from incompetence to corruption, and 2, by giving the government such a monopoly position, you're definitely inhibiting competition. And to answer your more specific question, I would say that for the most part, a single-payer system would be beneficial to those who don't make all that much money, who would therefore be able to receive some decent coverage that they would have otherwise not been able to afford, whereas more affluent individuals, people with more money at their disposal, are probably more likely to prefer the flexibility that comes with having a privatized healthcare system. So there is a bit of a discrepancy here for sure. For today's second question, and hello internet, this is Shaila, our other cat. Ivan would like to know if we can make a meaningful comparison between the European healthcare system and the healthcare system of the United States, generally speaking. And I'm pretty tempted to say no, because look, for example, Switzerland and my country, Romania, are both in Europe. But despite the fact that both countries have what you would call socialized healthcare, you have Switzerland that has a better healthcare system than the United States on the one hand, and on the other hand, you have Romania that has a worse healthcare system than the United States. And I think your question leads us to an important conclusion, specifically the fact that it's not just the healthcare system type that matters. There's so much discussion about it, and rightfully so, but some people do tend to make the mistake of assuming that, everything's going to be fine if you just pick the right type of healthcare system. No, that's not correct, because it also depends, and it's probably just as important, how that system is managed. So please don't make the mistake of assuming that the discussion should be limited to, should we have socialized healthcare or privatized healthcare? No. The discussion needs to be a lot more meaningful, and we need to dig deeper if we're serious about drawing conclusions that actually, help us work towards our goal of having better healthcare. And of course, it's something everyone wants. Today's final question has been asked by Mike, who lives in China and would like to know how I would explain the current healthcare situation in the United States to someone from China or for any other country for that matter. And the United States is definitely in a tricky situation, and I'm going to share two images which illustrate that. And the first image shows us that it is the country by far that spends the most amount of money on healthcare on a per capita basis. So you have the biggest economy in the world, a country that spends the most in the world on healthcare for each citizen. So naturally, you would have probably expected the US to have the best healthcare system in the world, but it doesn't. And look, for example, Switzerland that I referred to previously is the second country in the world ranked by life expectancy, whereas the United States is the 31st. And I'm going to share another image right now, which displays some other data points as well, like the average number of doctor consultations. And you're going to see again that the United States healthcare system is not the first in the world, it's not the second in the world, but rather that the rank of the United States compared to other OECD nations in this specific image ranges from 26th to 29th. So there is definitely a significant discrepancy between the amount of money that's being invested and the results that are being obtained. And therefore, a lot of people from the United States are frustrated, and naturally, they start thinking that maybe it's a better idea to just change the system in light of the fact that the current one is definitely generating, let's say, suboptimal results. That's it for today, guys. Thank you very much for tuning in to another edition of 1 Minute Answers from 1 Minute Economics. And remember that the topic for next week is war. So if you want to ask me anything at all related to the economics of war, to the effects of war, and so on, then simply write a comment below and I'm going to do my best to answer your question next week. As usual, please do your best to comment on my videos, to like my videos, to subscribe to 1 Minute Economics if you're not yet a subscriber. And of course, if you can, I'd highly appreciate it if you could head on over to 1minuteeconomics.com to find out how you can support the channel financially as well. Thanks a lot, guys, and have an awesome weekend.